Good afternoon. Just before we go on to the county monitoring, I just also wanted to highlight that, just punctuate the point that the governor made, which is that we have throughout the state distributed millions of masks to a number of sectors, not just the health partners that we began the COVID conversation talking about, but all of these listed sectors. And this comes because of the execution of our contract statewide with BYD to bring masks to California and be able to provide those to these important sectors so that not only can we protect the workers, but also allow those clients or customers who come and interact to be protected as well. So it behooves us not just to double down on these efforts to get masks to these various sectors, but also that we as the public deliver our own promise to those workers and to protect them by donning our own face covering when we interact with them in a store or in a different setting. So as the governor mentioned, we are this week looking at 11 counties. And as you can see on this slide, just like the one we reviewed last week, there's a number of data points that we've been tracking. We've been looking at a county's ability to provide testing at a level that allows us to feel comfortable with our ability to pick up positives when we have to and be able to contain that spread, our ability to look at overall disease transmission, our ability to look at the increasing hospitalization numbers, and then the ability of that hospital capacity in a certain county to manage those increasing cases. As you can see, in general, all of the counties have the capacity of ICU beds and ventilators that we need to continue to support the patients that are presenting and need that level of care. I think it's very important that, as the governor underscores the level of preparedness that we've had, that we want to ensure that as few people become sick as possible, and even though we have that capacity, that it's not capacity we want to use to treat COVID-19 patients. We would much rather people practice physical distancing, wear their face covering, practice good hand hygiene, stay home when they're sick, and all of the things we've been advising so those beds remain available but not used. I want to just highlight a couple of things on the table in front of you. Focusing on two new counties on the list, Riverside and San Bernardino, where we have over the past many days been in communication with those county public health leaders and leaders overall to have a conversation not just about the spread in congregate settings like skilled nursing facilities or even jails and prisons, but the fact that we're starting to see additional spread in community settings. So those are cases that can't be linked to necessarily a congregate setting that is spreading within households that live in closer quarters, maybe in communities where they have a number of multi-generational households, and where we're not just seeing that uptick in the number of cases as reflected in the case rate increases, but also in the commensurate hospital increases that we're seeing. So not only do we see increased cases in certain communities and certain counties, but those increased cases are not just because of increased testing, but actually becoming increased number of hospitalizations, and in the future may put pressure on our ICU capacity and our ventilator capacity that we want to maintain to keep our communities safe. I also want to identify Stanislaus as a county that is on the county monitoring list for the first time, and then continue focus on Los Angeles County, where despite a good job in maintaining their hospital capacity, doing quite a bit of testing, we still have a very high case rate, which we watch closely because of the dense population in Los Angeles County. A number of the other counties we've been following very closely. Imperial, which is a county we continue to be concerned about and talk about both in this Newsom at noon conversation, but throughout the course of the week to make sure that we have the bed capacity, not just within Imperial County, but also in surrounding counties that have really stepped up and taken patients who've been sick in Imperial and need both hospital or ICU level care so we keep all of Californians safe. So we will continue to update this list on a daily basis and share it with you every Monday so you can track with us those areas where we are concerned. As the governor promised, I just wanted to spend a minute talking about the power of decreasing exposures. So as you can see on the top line, with no decreased exposure, so that means going about our business as California reopens without much care or thought about wearing face coverings, about remaining physically distanced when you can in a store or another setting, even while you're outside, that you see that one person within 5 days can infect up to 2.5 other people, which may not seem like a lot, but when you stretch that out to 30 days, we're talking about over 400 new people who are been exposed and infected. And those 400 individuals go on to infect even more, and we begin to see quite a radical and steep increase in the number of cases, which then leads to a radical and steep increase in the number of hospitalizations potentially, as well as ICU stays. You can see with just a 50% reduction in exposure. So that's a combination of remaining physically distanced, wearing your face covering, frankly, staying at home as much as you can, and ensuring that when you're sick, you stay at home. When you're sick, you reduce your interaction with others, even those people in your own family, and that you continue to practice good hand hygiene, that we can reduce exposure so that over the course of 30 days, not 400 people get infected, but just 15. Even farther, if 75% less exposure, so that means wearing our face coverings even more often than we might otherwise, staying home even more often when we have symptoms or are concerned, and making sure that we practice that physical distancing that the governor and many other people have been talking about, we can reduce the number of people infected 30 days out from our own or one person's own infection to just 2.5 people. And that is exactly how we control the spread in California, ensure that our preparedness over the last few months continues to serve us well, and ensure that we continue to keep that curve bent and that we have the capacity to keep Californians safer as we begin to move forward with our economy and have more and more sectors reopen. I just wanted to talk about one last point that we have been discussing for weeks now, and this is our contact tracing capacity. A number of you have seen in the news over the past few weeks a focus on contact tracing. I will say one point, that contact tracing is only as robust and good and successful as we have the capacity to allow people who are close contacts or even positive cases out of those contacts to be able to isolate safely at home. And that means in a supportive way where they're able to be isolated, have the food and other necessities to be able to maintain that isolation safely, not just from the community at large, but even from people within their families. And we set out a goal to have 10,000 individuals trained to be part of that contact tracing workforce across the state by July 1. We continue each week to train state staff that are being repurposed to do that service, as well as working closely with our county partners who have both retrained and redeployed their own county staff to do this work, as well as invited hundreds of others from community-based organizations and other sectors to help join this army. And we are continuing to work towards that July 1 goal, and we'll go even farther as our cases increase, and we have the goal to make sure that every case in California receives the type of disease investigation and contact tracing that we know is necessary to keep the spread of COVID contained. We also just want to highlight that 31 of our counties are onboarded already on the California Connected platform that we launched a few weeks ago, and that we're in process of having an additional 20 counties join. That isn't to say that the other counties who won't be part of California Connected's platform aren't themselves reporting and managing the data as it relates to contact tracing. They certainly are. We are just having a single shared platform for as many counties as needed so that we can, in an organized, methodical way, be able to watch the spread of COVID-19 and ensure those who are close contacts get the support and care that they need. I want to just end by reinforcing this, because today's message isn't just about the when something reopens, but really about the how. The governor said clearly that we have spent weeks, months even, preparing guidance for sectors that are many, many pages long with specific details on how a sector more safely opens and reduces risk for both their workers and their customers and clients. But it really comes down to these things that we can all continue to do and do more of. Wear our face covering, the order, that the directive, the requirement to wear face coverings that California put forward last week by California's Department of Public Health, the old, now very common sentiment that physically distance makes a difference, that keeping 6 feet apart will actually reduce the spread of COVID-19, just as the governor's initial slide that showed how droplets spread. This is the purpose for doing that. Washing your hands cannot be overstated. Washing your hands for at least a couple rounds of the ABCs, as I tell my pediatric patients, or long enough that you at least 20 seconds, but making sure that you do that enough to reduce the transmission. Answer the call. We're having contact tracers from throughout the state, whether it's locally in your counties or some of the state staff. Call individuals who may have been exposed to understand what their real exposure was and whether they should isolate as well. It's important that you answer that call. We will continue to deliver that message. And then I just want to end by reinforcing that despite the fact that we are having more and more movement and mixing as sectors reopen, our strong support for individuals who are older or who have underlying medical conditions to stay at home as much as possible. We have spent the last many months asking questions and preparing to support those individuals as they stay at home, but because the virus is still spreading in our communities, because transmission is no different than it was before, we want to continue to support older Californians and those with underlying medical conditions to stay safe and stay home. So with that, I'll turn it back to the governor.
Thank you, Dr. Ghaly. And as always, we want to encourage you to learn more about all of the above and get the benefit of understanding what's happening in your local community by going to the covid19.ca.gov website, covid19.ca.gov website. Again, it includes not just information that we provided here today, but those attestations, those protection plans, the specific details within your counties, the guidelines, the sectoral guidelines that we just put forth. Also includes updates on testing, the tracing work that Dr. Ghaly was just referring to, and provides a little bit of a dashboard, a little bit more clarity and insight as to how certain counties are performing versus other counties. And as always, we encourage you to go to the testing site on covid19.ca.gov. If you feel you need to be tested or you know a loved one that you would encourage to be tested, go to that site and then just type in your zip code and you'll learn from close to 90 different sites that are on the COVID-19 platform what's available near you and the cost, which is in almost every case negligible or zero, as these are subsidized examples, or at least subsidized locations that we've worked hard to provide for people regardless of their means. So look, bottom line is, as we move forward, to be sober about the reality that, again, we are still in the first wave of this pandemic. To again remind ourselves the power and potency of our individual decision-making, our ability to bend this curve, ultimately to bend it down until we have a vaccine, until we are in a position to turn the page on COVID-19. It's your individual decision-making that will determine our fate and future, our capacity to mitigate the trend lines that you've seen that we presented here today, to mitigate the likelihood and need that we ever have to toggle back on these stay-at-home orders and revert back to where we were just a few months ago. We don't intend to do that. We don't want to do that. But I want to make this clear. We are prepared to do that if we must. Clearly, we have the capacity, individual and collective capacity, not to have to go in that direction by just being a little bit more thoughtful about how we go about our day-to-day lives. Read up on these guidelines. When you go to a restaurant and it's clear that they're not practicing what we are preaching, report that. Give us the tools to enforce. And I want to make this point clear because invariably it's asked of me on a daily basis and likely to be asked in a moment when I turn this over to questions. What is the enforcement mechanism? Foundationally, we look to local government to drive the enforcement. But we more importantly look to the moral persuasion each and every one of us have as individuals to, again, be good examples. So that when we're out and about and we're wearing a face covering, we're not only protecting ourselves and protecting our loved ones in the broader community, but we're also sending a message to people that they should consider doing the same. Our goal is not to be punitive. Our goal is to educate. Again, we're just a few days into this mandatory face mask guidelines. That's why I put at the front of this conversation that video, again, deep gratitude to the former governors for being willing to participate in that video to highlight the importance of wearing face coverings. The next slide that I put up, about the 26 feet when you sneeze, that droplets can travel, I just hope underscores the seriousness to which we place this face covering mandate and the encouragement to have you and others participate in doing the same. But beyond that, the state of California and local government has the ability from a regulatory perspective to go after people that are simply thumbing their nose and abusing the privilege of this moment and not putting your best interest, your health interest at heart, or even their workers. The state of California has that ability, just as an example, and we're using the restaurants to the alcohol beverage control. I was on a conversation call today with many governors across the country. In fact, it was an all-governors call with the Vice President of the United States, comparing and contrasting best practices. There wasn't one governor that spoke that didn't speak up about the importance of enforcement and the relationship they have in terms of not trying to be punitive, not trying to be too aggressive or heavy-handed, but at the same time, being able to utilize tools in the toolkit. Again, focusing first on the cities and counties and the regions doing the same, the state from a regulatory perspective, not least of which ABC, but also OSHA, and the capacity, again, to educate workers, the importance, and or rather employers, on the importance of protecting their workers and advancing the principles of the guidelines. Again, guidelines say how to reopen safely. And it's incumbent upon those within industry sectors that helped us, many cases, leaders in those sectors helped us draft those guidelines to procure strategies to manifest those guidelines to keep you healthy, to keep you safe as we transition out of this first wave and prepare for the fall and the likelihood of a second wave. I want to just close by making two additional points that were highlighted by Dr. Ghaly and can't be reinforced enough. You saw that one slide that showed 130.1 million masks that have been distributed throughout these sectors of our economy, the transit sector, our education system, obviously within the health and human service sector, the agricultural sector. We also, because of the magnitude of our capacity now as a purchaser, We currently have an inventory of 199 million masks. We've distributed 130 million. We have an inventory of 199 million. We're trying to turn that around as quickly as possible and get through all of those orders of masks within sectors and throughout the state, counties, cities, healthcare systems, and the like. By the way, that includes the precious N95 masks. We've received over 11 million of the N95 masks. Tens of millions more will come in over the course of the next few days and over the course of the next few weeks. As soon as we get those in, we want to get those out as well, particularly to our most vulnerable workers. Again, the heroes of this pandemic, our nurses, our doctors, the people that continue to be on the front line in the ICU, in the hospitals settings, and the like. And so I just want folks to know that we're very, very proud of the magnitude and the scale of our procurement and our capacity to help support the many sectors within the state of California. And accordingly, and you saw on that slide on the 130 million that we've already distributed, we've also been able to help because of the partnership we formed with FEMA, which has been exceptional. We've also been able to help some other states with their needs as well. So it's a point of pride and a point of privilege that we say this, but again, point of protection for each and every one of us to wear these face coverings and to make sure that we mitigate the spread, again, through this, what we call non-pharmaceutical intervention. There are two non-pharmaceutical interventions that we know that work. That's staying at home, practicing the kind of physical distancing that a stay-at-home order provides, and then wearing face coverings to mitigate those that cannot practice the physical distancing and social distancing when you are in cohorts where you're mixing with people that otherwise you had not mixed with in some period of time. So testing going up, 92,000 tests, a record in the state. Not surprisingly, over the weekend, a record number of people that have tested positive. A positivity rate that is holding but is slightly now increasing. Hospitalizations that are increasing, but within a capacity that our system can handle. ICUs growing accordingly, again, within the framework of capacity our system can handle. More and more masks being procured, more and more masks being distributed, and more, dare I say it, responsibility on each and every one of us to practice the physical distancing and be thoughtful as we move back in and begin to mix into the economy with all of these meaningful modifications that we've seen in at least 54 counties in the state on the stay-at-home order. Final comment, because it's a point of pride, I want to just thank those that have participated in this Great Plates effort. I mentioned a few months ago, and it was just a few months ago, that California was going to become the first in the nation to provide meals for our seniors. Dr. Ghaly reinforced the need for me to reinforce this program by saying for those that are 65 and over, people that have comorbidities, morbid interest issues with their immune system, issues that relate to pre-existing conditions with age, how sensitive we are to your needs and our larger community needs within that cohort. If we're going to ask folks to stay at home, we've got to address the issue of social isolation, the issues that obviously manifest people that aren't feeling connected to loved ones and others that feel isolated and are indeed isolated, but also vulnerable. And that's why the Great Plates program was so important. It was conceived to solve multiple a number of problems. One, to address the nutrition needs. Great Plates is indeed about providing meals to our seniors that are isolated, but it's also to provide a sense of continuity of care. We announced on Friday that over 1.6 million meals now have been delivered just since the creation of this First in the Nation program, and how over 5,800 jobs have been supported, not only within the restaurant industry, but helping support those that are delivering these meals. But one of the things that was so humbling and so extraordinary, and it's the reason I'm bringing this up, are the number of letters that we've received, cities, counties have received, mayors have received, that they've forwarded to us, that we realize it's not just about delivering nutritious meals. It's about that knock on the door, the only knock that a senior may receive on any given day. It's about that phone call saying, how is the food? And was it to your liking? Is there anything more I can do from the restaurateur checking in on the senior to make sure that they're providing quality? And the fact that someone reached out, made a phone call, the fact that someone knocked on the door, the fact that someone delivered that meal has been as impactful in some cases, based upon the letters we've received, as the meals themselves. Ability, again, to connect to people that feel totally disconnected and isolated, fearful, fragile, literally and figuratively at this moment. And so I just want to encourage all of you, not just through a program like that that's been so successful, over 30,000 seniors getting the benefit of this program. Again, not every senior gets the benefit of the program. It's an income eligible program. It's people that otherwise are not eligible for other programs that get the benefit. But the fact that we're doing it is just testament to individuals that are discovering something even more extraordinary, and that is the power and potency of their voice and their willingness to connect on a human level with another person. And that's why I just want to encourage you, even if you're not part of the Great Plates program, become part of something bigger than yourself. That COVID-19.ca.gov website also has volunteering information, has information on how you can support seniors and how you can just make calls and check in on strangers, see how they're doing, make a difference in people's lives. I always say the happiest people in the world are volunteers. So if you're feeling a little down, you're feeling a little blue, you're feeling, again, fearful, anxious, again, a little fragile, one of the most significant ways you can change your own outlook on life is by reaching out to someone else and checking in on their life. And again, I can't be more encouraging than your capacity to make a difference in other people's lives, and in turn make a difference in your own life by checking out those volunteering opportunities. COVID-19.ca.gov, wonderful resource for that as well.